And the passing of the Senate bill would also mean the end of various health programs that are available free of charge for women who need them. That includes places like Planned Parenthood, who provide free exams and other screenings. This morning we have Patricio Gonzalez from the McAllen office with some answers. Thank you so much for being here with us.
Thank you so much.
So let's talk specifically about the bill. How will this be affecting women in the Valley?
It will be, if the bill passes, the 2 clinics that are currently available in the Valley that provide abortion services would close down. So that means women from the Valley would have really 3 options. One, to travel all the way to San Antonio, 235 miles from McAllen, 250 miles from Harlingen, to get a safe medical abortion or legal abortion. Or they would also, some of them, the uninsured, the poor, would probably resort to go to Mexico to try to get one over there and place themselves at great risk. Or third, they would try the black market, again placing themselves at great risk. So all 3 are very place a lot of risk and a lot of barriers for women in the Valley.
And you brought up a great point, because the fact is that women that are of a lower socioeconomic status, you know, that's basically why they're getting these abortions, because they just can't afford to care for the child. So it's going to be difficult for them to travel the 235 miles, meaning that they'll have to resort to either B or C option.
Exactly. And that is what we're very concerned about, because this bill does nothing to improve women's health or safety at all. I mean, mandating the size of a room or the size of a hallway has nothing to do with the medical care that a woman gets. Currently, they're getting good medical care in these clinics, and statewide there's regulations. So this bill does nothing to improve a woman's health and safety.
The other point on regarding this bill is that many clinics, like you said, are going to have to close, and these clinics provide those health services to women that they need.
They provide basic examinations, birth control, lab services. They do basic preventive health care. So yes, out of the 46 clinics statewide, 40 would be closed. Only 6 would be around opened, and those 6 are primarily in the big cities: Houston, San Antonio, Dallas, Austin. So people in the Valley, people in rural areas, would have to travel great distances to get a safe legal abortion.
What would you, I know that Planned Parenthood is actually, you were telling me they're actually thinking about taking some steps to improving their facility.
Yes, our board, my board and I had a discussion that if this bill passes and the 2 clinics here are closed, we might have to look at trying to meet these regulations and trying to start the service for the women in the Valley. We're still looking at it. We're still talking about it.
And currently Planned Parenthood doesn't provide
We
that
don't
service.
provide them currently because we had these other 2 clinics that did them, and we didn't want to duplicate services. We wanted to focus on preventing the need for abortion by having women placed on contraceptives, birth control, which by the way, the governor and the legislature 2 years ago dismantled, just took it all away. So if you really want to prevent an abortion, have women get on birth control, practice family planning, get their physicals, their PAPs. That's women's health care. That's safety there.
Okay, well, thank you so much for being here with us this morning. We appreciate your time.
Thank you.
Mary, back to you.